Hi guys, how are you doing today? So today the topic we are going to discuss, the issue is something that surrounds us all, unfortunately, is the topic of epidemic and coronavirus. First, we are going to introduce the vocabulary and try to see how it works in context. So we are going to do some listening. And at the very end, we are going to try to learn together some expressions that are helpful and useful. Now we are going to introduce vocabulary related to epidemic and coronavirus. Virus, outbreak, quarantine, contagious, distinguish, mortality rate, diagnose, vaccine, recover, sanitizer, prevention. Okay, so now let's check it out in practice. You are going to see text and you are going to listen to it as well, and you will have opportunity to see how the vocabulary is used in context.
6 facts about COVID-19. Number 1. COVID-19 started in animals. This particular coronavirus jumped from animals to humans in late 2019. The outbreak began at a seafood market in the Chinese city of Wuhan. A Chinese doctor who warned the medical community about the virus died from it on February 7th, 2020. Number 2. COVID-19 is contagious. According to many health experts, the average person who contracts COVID-19 will pass it on to about 2 other people. To limit the spread, those who have this contagious illness or who have been near someone who has it should go into quarantine. Number 3. COVID-19 symptoms are similar to the flu. It's difficult to distinguish flu symptoms from coronavirus symptoms. Typical symptoms of this coronavirus are fever, cough, and shortness of breath. Most COVID-19 patients do not have a runny nose or sore throat. Number 4. The mortality rate of COVID-19 is unknown. At this stage, health experts can only estimate the mortality rate of this coronavirus. Estimates range between 1% and 4%. Many countries lack the testing kits to diagnose this virus. We do know that elderly people are at a higher risk of death than young people. Number 5. There is no vaccine for COVID-19. Health experts are working on a vaccine for this coronavirus. However, they estimate it will take at least 18 months before it is available. Fortunately, many people with the coronavirus recover without any treatment after 1 to 2 weeks. Number 6. Prevention is key to limiting the COVID-19 outbreak. To prevent the spread of this virus, health experts recommend washing hands with soap and water for at least 20 seconds or using hand sanitizer. It's also important to cover one's mouth with a sleeve or tissue when coughing or sneezing. People with flu symptoms should stay at home.
And now let's check out some useful expressions which you can use in conversations with doctors, for example. Have you recently been abroad? What are your symptoms? Have you been in contact with anyone infected with COVID-19? Traveling is restricted. There is a ban on gatherings. Quarantine is mandatory. I have difficulties with breathing. I have a fever. I have muscle ache. Okay, guys, so that's it for today. Thank you very much. I hope you found it useful. Just let me know if you have any suggestions for the next topic, or if you would like to have individual lessons with me, let me know as well. I hope to see you next time. Thank you very much one more time, and bye.